You just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I'd printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
That if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that. Dies with COVID-19, we are counting that as a COVID-19 death. Counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana.
There's people going, Dr. Tenpenny, what's going on? What do you think? What do you think? And I just sat back and just watched. I just sat back and watched for a while because there was so much and still is so much conflicting information out there. You'll read one set of articles where people say, this is nothing more than a stronger flu. It's just a more aggressive flu. And you see that in the scientific community enormously. The scientists are all saying, why are we doing this? And then you hear the hysteria in the mainstream media that 200 million people are going to die. And, we've got to shut down, the entire global world economy. We've got to put people out of work, out of business. We got to put in $6 trillion into, circulation to support the flu. The entire global world economy. We've got to put people out of work, out of business. We got to put in $6 trillion into, circulation to support the flu.
Okay, people, if you're looking for conclusive evidence that this COVID-19 is a rigged hoax, well, you need look no further than here. This is the CDC's website in America, the Center for Disease Control, and it's the National Vital Statistics System, guidance for certifying COVID-19 deaths. March 4th. The National Centre for Health Statistics is receiving questions about how deaths involving the new coronavirus strain should be reported on death certificates. We are working on formal guidance to certifiers to be published as soon as possible. In the meantime, to address the immediate need, here is some basic information that can be shared in advance of the more formal and detailed guidance. Now, pay attention. It is important to emphasize that coronavirus disease 2019 or COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Okay? So it can be assumed that the deceased had COVID-19, coronavirus, and that will be put on the death certificate as the cause of death.
Let me just chime in right here because he didn't cover this. You can put down that it's SARS, CoV-2 can be used as long as it's clear that it indicates the 2019 strain. But we would prefer use of World Health Organization's standard terminology, e.g. COVID-19. They're lying. They are lying because COVID is a simple, mild flu.
This virus, this coronavirus too, is not more than a severe cough, and it's totally implausible that it's passing from human to human by healthy humans coughing. That's not how it happens. It's far more plausible that it's been injected. And yes, essentially every vaccine carrying human animal cells, Pediarex with Vera monkey kidney cells, we give that to infants. The flu vaccine in bird avian cells carry coronaviruses.
This is Dr. Judy Mikovitz. Okay, she's going to go on and on and on, but literally she's saying the same thing I've been telling you since day one. You can't catch it airborne. It has to be injected. Hey, what's up, YouTube? It's Richie from Boston. It's the 31st. It's March. It's 2020.
Practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Dr. Fauci talking to this talking head today. Dr. Fauci explains the new coronavirus timeline. So pay attention to this.
Let's bring in a man now who's become familiar.
Remember, they're touting Dr. Fauci as America's top expert on infectious diseases. Remember that, okay? Now remember that. And remember, a couple of other things. Since this whole thing broke out, my channel's demonetized anyways. I'm not selling anything because money's not going to matter after this entire thing crashes. So anybody that's still trying to sell you things or asking for PayPal or Patreon or anything else, you may really want to understand what their motives are. Do you see what I'm saying? Just remember that. But this is America's top physician right here. Let's listen to what he has to say today.
America's top expert on infectious disease, Dr. Anthony Fauci. Dr. Fauci, thank you for your time this morning and for your tireless service over these last several weeks and years. As we heard from the president all last week, he was hoping that we could reopen the country by Easter, but of course, we saw that extension of the guidelines yesterday. Take us inside that decision. What convinced the president was necessary? What convinced you?
Well, it was clear, George, that the dynamics of the outbreak, what was going on in cities like New York City and Westchester and New Orleans and others, was clearly still on an uptick. And to pull back the mitigation methods before you reached the peak and turned the corner, I think really would have been imprudent, because that would have merely regenerated the spike to go up. So we had some intensive conversations with him, and we convinced him. He listened, and we said the better part of valor would be to extend them until the end of April, when we think it would peak and start coming down. I mean, these are all projections, but the thing we're pretty sure of is that if we prematurely did it, it would likely rebound, and that's one thing you did not want to happen.
You talk about the peak at the end of April. The president seemed to say yesterday that the models estimate the peak death rate in 2 weeks. So which is it? Is it 2 weeks from now or the end of April?
Well, what he was saying that the number of deaths would probably peak by a certain point, but you still get a number of cases that go up, which will ultimately lead to less death rates because the cases anticipate the death rates. What he was saying, that we had such a surge earlier that within 2 weeks you're going to have a peak in the death rates. The death rates start coming down, but you have another curve, which is actually the new infections.
Okay, so did you just hear him saying a bunch of nonsense bullshit? Now, see this? This is Dr. Fauci right here. See him? That's today. Today, he's telling people we need to be locked in until the end of April. Dr. Fauci, see him? There he is. Now, this is the article I showed you yesterday in the New England Journal of Medicine. This is where doctors talk to each other. This is doctors' forums right here. This isn't the Daily Mail telling you that people are locked in Cheyenne Mountain. This is the New England Journal of Medicine. This is Dr. Fauci, the same guy. See him? He wrote this article on the 26th, which was 4 days ago. Dr. Fauci said 4 days ago in an official medical peer-reviewed type magazine that this suggests the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal flu, which has a fatality rate of approximately 0.1%, or a pandemic influenza, rather than a disease similar to Sars or MERS, which has a fatality case of 9, 10, 36% respectively. What's up, YouTube? It's Richie from Boston. Today is the 25th of March in the year 2020, and I am in another state, and there we go. I am joined once again by Dr. Andrew Kaufman. Dr. Kaufman, thank you so very much for making the time to come back and talk to people, because people have so many questions, and your opinion matters more than anyone I can think of right now.
Well, that's very kind of you to say, and it's really, I enjoyed the first time, and I've got important information to talk about, so I'm really pleased to have this opportunity.
No problem. The links that you sent me are staggering. It is amazing how mainstream is suddenly somehow flipping the switch. But before I forget, right off the bat, I've been telling people that according to peer-reviewed paperwork from the medical community that go back all the way to Louis Pasteur, I believe, a virus has never actually been proven to kill anyone. Is that correct in your medical opinion?
Well, I would take that a step further. A virus has never been proven to exist that causes disease. So if it doesn't exist, it certainly cannot kill anyone.
Now, there's that. I already knew that, but I just wanted to have you reiterate it as simply as possible. The second one is, if everything you just said and everything the scientific and medical community know is true, then how could this thing be transported through the air?
Well, I don't believe that it can be. And
I mean, dude, have you seen how the social distancing is? I've got people that are, their work will fire them if they are more than 6 feet close to each other. They have to maintain 6 feet apart. This is insanity.
It truly is the end of the world as we know it. We need to take a stand. Refuse forced vaccines. Destroy 5G technology any chance we get, and don't let them fill you up with fear. From what I gather, they lose in the end anyway. I really hope that's true. And this life is only temporary, so don't be scared. Be strong and stand up for yourselves. I know one thing for sure, I'll die or be thrown in a FEMA camp, or worse, before going along with what they're doing right now. Maybe you should consider doing the same thing. This has been ODD. Never sleep again, my friends. Take care.